Good afternoon, everyone. I'm going to start in just about another minute and a half. Just a few more people, it seems, are joining, and sometimes it takes a little while to get on. And thanks for joining us. My name is Lisa Kleinbub, Executive Director at Regional Center of the East Bay. And the topic for today are just a few updates like we often have, and then I'm going to talk about our performance contract that we will be submitting to the Department of Developmental Services. The process of the performance contract is to get community input during this time period, and we submit it for 2021 by December 1st of 2020. Previously, we've had some webinars on the outcomes of our performance contract, and now we're going to start looking forward to 2021 and what activities we want to do to support the objectives that we have to meet and any other ideas that people have in the community. So I'm going to start now with sharing my screen. Sometimes this takes a little while for it to be comfortable to start. Okay. So let me just share with you that right now, as of the 14th of October, we had 110 positive COVID cases in our community that we know about. Our numbers have really been stabilizing. We are not every day having someone we're hearing about positive with COVID. It's probably now about 2 a week that we're seeing at this time period. In Alameda and Contra Costa County, we see that Alameda County is in the orange zone, which is really not as much spread of COVID. And Contra Costa County should move to the orange zone next week. Both counties are making decisions on reopening, but all indoor activities still require social distancing and the wearing of face coverings. I just wanted to go over the alternative services. Last month in September, anyone who attends any kind of non-residential service should have been reached out to by their service provider if that service provider is offering alternative services and not just traditional services. So for example, if someone receives respite and they're receiving that directly right now in their home, that wouldn't be an alternative service. However, many day programs, other activities have migrated to being half online, half by materials being delivered, and those folks would be alternative services. And in September, they were to provide a meeting with people served and agree on whether the person wanted alternative services and what services. During this month, all of those folks should be meeting with their provider and talking about exactly what the schedule is, how many hours will be provided, what specific services. And that should be kind of happening. And if people are not necessarily pleased with what's happening and they provide feedback, they want to see changes, services should be adapted as needed. Our consumers and providers both have to participate in this, and we expect it to be a collaborative process because for many people, it's the consumer and their residential supports, as well as family, and any kind of non-residential supports. So things really have to be a collaborative process to make it work. During the month of October, we are expecting to be able to share what the monthly rates for providers will be. And we will be working on getting that data out. We haven't received those rates from DDS yet, but providers will find out those rates and they will bill for a month of service. And there is not a minimum service requirement to bill for the monthly rate at this time, but we will expect the ISPs to really reflect what the needs and preferences of the individual served are. So I'm going to talk mostly today about the performance contract. And our Welfares and Institutions Code, which is the Lanterman Act, requires that regional centers have contracts with the Department of Developmental Services that include annual performance objectives. And we're required to develop those performance objectives through public processes. And most of the objectives that we have to meet are required for all regional centers. There are some areas, specifically the area of disparities, in which we are allowed to select objectives from a limited list, so we're not fixed on any one objective. While most of these are required, we are able to develop local objectives. We didn't develop any local objectives in 2019. And in areas where we saw a need for improvement, those are the areas in which we should work to focus on change. The department reviews the baseline and year-end information to evaluate our performance. It's seen that we're successful when the outcome has improved over the prior year's baseline, or our performance exceeds the state average, or the performance equals a standard that has been defined by the department, such as did we pass an audit, and that's a yes or no question. The performance contract has a number of compliance measures, and this is where we do see yes or no questions are met. We have measures where we have an unqualified, which means a good, clean audit with no material findings, that we are substantially in compliance with DDS's fiscal audit, that we operate within our operations budget, that we are able to participate in the Medicaid waiver, that we are in compliance with vendor audit requirements, and that our client development evaluation report, our early start reports are current, that we meet intake and assessment and IFSP timelines for early start, and that we meet intake and assessment timelines for those over the age of 3. In terms of IPPs and IFSPs, we are also supposed to meet timelines and fulfill the requirements in those areas. We also have what are called public policy performance measures. In general, these fall in these categories: that fewer individuals live in developmental centers, more children live with their families, more adults live in home settings, fewer children live in large facilities, and fewer adults live in large facilities. And large facilities are defined as any facility that's over 6 people. And as we look at each of these outcomes, I want you to think about, as you're thinking about what you see here, are there activities that you would suggest to support a positive trend on these outcomes? What supports might be offered to see progress? Are there any previous activities that we can continue or that we can not continue? So one of the public policy objectives is that minors should live with their families. So we're supposed to increase the number and percent of minors residing with their families. And right now, this is a number that's in the high 90s. And we've had this list of activities, and last year we added developing updated materials to support families in accessing Medi-Cal through institutional deeming, and we included providing crisis intervention services through the mobile crisis team, the children's crisis home, and working around using some intensive wraparound services. So one of the questions we have is, are there any other things you'd like to see us do to work to support people living at home with their family who are minors? The next area is increasing the number and percent of adults residing in independent living. And so activities these have been fairly standard is we continue to provide information on living options at transition fairs. We continue to work with local housing agencies to increase accessible and affordable housing, support access to generic community resources, train our case managers on ILS services, and continue to meet with ILS vendors. Another area is adults in supported living, and these are the activities that we've traditionally done in order to support that, collaborating with the SLS providers, providing living options, workshops, and one of the most important things right now is to work with local housing agencies so that there is accessible and affordable housing. We also have an objective to increase the number and percent of adults residing in family homes, and we support access to generic community resources, and we continue to provide funding for services and supports that assist families in keeping their adult son or daughter at home. And we'd like to hear if anyone has any thoughts on other things we can do to increase this support. In terms of people living in smaller facilities, almost all children in facilities larger than 6 are adolescents that are receiving mental health treatment. And so our activities in that area is we want people to return to the family home, our smaller living environments as soon as possible. And we are collaborating now with local counties to support transition of our mutual children in foster care residing in large facilities. For adults, we have many older facilities that are larger than 6 beds, but we've been encouraging for new providers to develop homes that are even less than 6 residents. There is this new rate structure that allowed for 4-bed models and has a rate structure that supports that. And we're going to also be supporting our larger providers to be consistent with the CMS final setting rule and support large providers to apply for funding to come into compliance. I'll take questions and comments at the end, but the next area in which we have basically fixed objectives to meet is in employment. And I'll give you a few examples. There's a lot of data kept on employment that we work on. One is we're supposed to report, and we're supposed to see an improvement in this, the percentage of adults who reported having integrated employment as a goal in their IPP. And the measure for this is the National Core Indicator Survey. And the last survey of adults was in 2017-18, and we actually had lower numbers of people who reported this than we did in the previous 3 years. And so we're hoping that because we've had an employment specialist and there's been a lot more conversation about employment, that this number will be up in the 2021 National Core Indicator Survey. But we want to think about how we can encourage people to have those employment objectives in their IPPs. The next thing is increasing the number of consumers age 16 to 64 with earned income. And we've been doing a lot of work on employment with the Employment Task Force, but alternative ideas are certainly supported. The other thing is, once the average annual wages for consumers increasing, and that's a similar activities to support that. We are expecting to see lower employment numbers of individuals for the year 2020, simply because of COVID. And we were seeing many people choosing not to work or not being able to work during this time period. One of the things, though, is many adults have been working, and they've been working in very essential employment. So we have a mix of people. So because there's been a lot of enhancements of wages right now, we will expect maybe wages will go up, but the number will go down. The other area that is a required area is equity by age and ethnicity. And we got to select about 2 years ago from several measures. However, we're not allowed to change our measures in the equity realm because they want to look at this over time. However, we will post what our results were for 2019, and we will present all of the possible equity measures on our website within the next week. But the outcome under equity by age and ethnicity is that individuals of all ethnicities will have access to RCB-funded services necessary to meet the needs as identified through the IPP, IFSP process. And the measure of this is comparing the percentage that an ethnic group is of our population by age to the percentage of purchase of service that group has. And our activities in this area has been really working on increasing translation of materials into many languages, supporting local community-based organizations for varied groups with participation in event, provision of data and other needs, and targeted outreach to underserved communities, and working with our case management team that serves our Asian and Pacific Island community, as well as with La Familia that serves our monolingual Spanish-speaking community. So we're certainly interested in hearing any input on other activities that we could be involved with. And there's another measure that is equity by language. And this is that we want to increase our RCB-funded services for individuals who speak languages other than English. And when we look at the measure, it is looking at the per capita purchase of service expenditures by the individual's primary language. And those, they look at only the ones that are over 30 consumers. And this is an interesting number because it doesn't break it down by age, which can be important, but since you're comparing every language across the board, that's fine. And we have been looking at continuing to hire bilingual and bicultural staff. We've been working with a family home agency to develop.
Tenemos una agencia familiar para personas que hablan cantonés y hablan bien.
To provide communication access for those with ASL needs in their homes, and working on cultural competency training for RCB staff and vendors. And the final area, which we have not gotten data on yet, but we will be getting data on in the next report for the year 2020, is that individuals of all races and ethnicities will be satisfied with the services and supports received by the family and family member. And this will be looked at with what's the National Core Indicators surveys that take place about every 3 years by the State Council actually conducts these. And we are really trying to get better feedback on our IFSP and IPP satisfaction surveys to identify areas for improvement. We have translated the satisfaction surveys into more languages. We now have them in Vietnamese and Chinese, and we are working on translating them into more languages. We're also working on having those surveys perhaps be sent via like a SurveyMonkey link so that people can complete them right away and not wait to mail something, which can cause people not to send their surveys back. So I'd like to offer you the opportunity to share your thoughts on what activities RCB can be involved in to support these outcomes. And if you think there are any outcomes that RCB should have for the calendar year 2021 that aren't included here, please list that in the chat. I'll talk about that, and we'll keep a copy of the chat so you can provide that feedback. We have our previous performance contracts and final reports posted on our website under transparency. So if you scroll down to the bottom of our website and click on the pink highlighted area there, you will have that. Our draft for calendar year 2021 is going to be posted after our board meeting, so by October 27th, 2020. And we'll have a link for feedback, and we'll announce a public meeting for additional comment, and our board will approve the contract at the end of November. Please share comments with us, and we would like to hear what you think is important for us to work on in order to achieve these objectives. Let me stop the sharing here and see if we have any comments or anything, or does anyone want to, you can raise your hand in the chat and share comments with us about what you think might be important for us to work on. And I'm happy to unmute people if they want that, or if they want to write things in the chat. So I'll give you a little opportunity to do that. I know we have an active group here. I'm surprised that people don't have any other comments. You know, we have so many areas to work on, and so many opportunities to really think about what we might be able to do. Thanks, Esther. Suggestions for a local objective: develop new board and care homes for Cantonese and Vietnamese adult consumers in Alameda County. Thank you. That might be a good local objective. It might be a good objective for our the funding we can always get from for resource development. I will look at that as a local objective. One of the problems is we have to achieve this within 1 year. And so development of new board and care homes can take 2 or 3 years. So maybe some steps along the way to that would be a good idea. But thanks for that suggestion. Any more comments? What I'm gonna do is I'm going to look, let's see. Provide services for people to do their programs from home. That sounds like somewhat of what we may be seeing in the alternative service delivery. Renee, would you like me to unmute you if you'd like to talk? Renee?
Yes.
Can you share more of what you know about that?
Yes. So because I'm from home and I don't know how long it's going to be before there's a vaccine, and I'm wondering, because I can't go in person, what kind of alternative services does the regional center provide for people who have to stay home and do internships from their home because they can't go in person?
Yeah, one of the things that we're suggesting people do is take a look if they're not able to do the service they were traditionally doing, is look at what other daytime activities might be available through other programs that they could do as an alternate service. And I know that there are several day programs that provide classes and other activities that are accepting new participants. So I would speak with your case manager about that. So that would be the best idea for that. Thanks, Renee. I have a question. What are the steps you are asking facilities over 6 people to take to comply with CMS rules? Facilities can comply with CMS rules if they really have a broad way that people are able to get out in the community, are not limited to their residential site for everything that they do, that things like medical care are not on site, but they're something you go out into the community for. So I think that for most of our larger facilities, they have done a very good job of working towards meeting the final rule, because people are not getting all their services in one setting. But there are a number of things that we found that many homes did not have as many community activities, that they weren't always staffed as well to be able to take people to what they chose to go to as activities. So we've been really encouraging those types of homes to either consider downsizing or to consider really developing new ways of doing things with different staffing ratios so that people can get out to activities. I think that there are also funds available for larger facilities to downsize, and that has been something over the years that we've encouraged as well. So those are the things. Let's see. Are there other comments? I'm happy to unmute people. I know when I shared the performance contract outcomes from last year, there were some comments about some of the areas of disparity. And so if anyone has any feedback on activities in that area that we could be working on, we'd appreciate that. I can go back and share the PowerPoint again if you didn't see all of those. Let me do that. No, that's not the one I wanted to share. So in the area of equity by age and ethnicity, our activities of continuing to work with our bilingual case management teams and informational materials and supporting community organizations are what our activities are. We'd certainly like to hear any feedback on other things that we might be able to do so that people could benefit more from our services, and we'd have more equity in the services we saw. It's similar in terms of individual satisfaction. We have been reviewing satisfaction surveys, but we're going to try to improve in that area once we see these numbers. But are there suggestions for how we might improve satisfaction with services that are received? Are there things that are not necessarily what people want and that we should consider making changes? So we'd like to hear that. So there's a comment that there was concern about racial disparity in group home referrals. What steps is RCV going to take to rectify those disparities? Yeah, there have been concerns about what the process is for referrals to be made to group homes. Is there any bias involved in that? And RCB is actually going to take a look at that with a consultant to take a look at some of the processes and how referrals are made. There isn't a process by which we say we're going to make referrals to this home. We have a process that's a very individualized plan, and we want to make sure that we have an even playing field about who can be referred and how people get referred, and that everyone actually has an opportunity to share information about their services if they might fit a particular individual. And we also are interested in hearing feedback from consumers about what it would be that they want to see in those homes, and where there might be a disconnect in terms of what services might be provided. I think that, let me see. So when we have the comment on developing new board and care homes, we've been trying to develop family home agency homes for different communities, and we probably need to look into some more of the group home settings to meet people's needs as well. Yeah. Any other comments or hands raised? This is usually not as quiet as a group, but I'm happy to have you wait until we have the final drafts, and we will share with you when our next meeting will be. We'll be talking about the next meeting on the performance contract. We will have a public meeting that will probably take place at another time. I'm going to allow Patricia Albano to talk now. Are you unmuted, Patricia?
Yes.
Yeah. Thanks.
Hi.
Hi.
So I think one thing that that I would like to see regional center maybe brainstorm around is this whole idea of you know, a lot of times like so I'll put myself in the example. So like when I was my son was younger and I was, you know, starting off into this journey of like, you know, learning how to navigate the different systems. Mm-hmm. A lot of times I would be asked, well, did you ask your case manager about this? And I was like, well, no, I didn't know that thing existed. So why would I, you know, ask for something that I didn't know? So I think if there was a way to somehow educate families on what services are out there, I mean, whether they qualify or not, that's a separate issue. But, you know, I wouldn't know to ask for diapers. When my son was little and he was still not potty trained, I would have never thought of that there was an organization, well, at the time it was Regional Center that was funding the diapers. I know that now it's Medi-Cal, but I would have never brought that up as a need, because in my head, I'm like, well, this is my son. This is part of what I signed up to do when I had him, was to pay for formula, pay for diapers. But, you know, later on the road, somebody said, oh, no, they can. And I was like, well, I didn't know this. Like nobody So if there was a way to maybe, I don't know, go through a checklist with families of like, does your son need diapers? How are they doing with equipment? Because a lot of the times there's just needs that we would never think to bring up.
Mhm. Yeah. Do you think that would be something that would be great to do on paper, or should that be done with on a one-to-one basis with the case manager, or would that be good done in like videos? I've been hearing some regional centers do videos for different age groups. Just curious.
So I think all three would work. I think it has to be a conversation that's individual with the parent. Videos definitely, but I just know that not everybody has access to these videos.
Yeah.
I mean, I don't think I ever visited the regional center website for many years
Mhm.
when I was starting off. So,
Yeah.
but some people do. Some people that's the first go-to person,
Yeah.
place is the website. So,
Mhm.
and then also having a checklist, because again, I may have a conversation with my case manager one-on-one, but it may not come up. So if there was a checklist that the case manager has to go through and discuss. So I think all three, just to cover all your bases.
Okay. Thanks, Patricia. Appreciate it. I have Rosa I'm going to allow to talk. Hi, Rosa. Somehow or other, I did not unmute her. Hi, Rosa. Did you have your hand up? Etta or Jairo, can you translate one of the comments in the chat?
Yes, she's asking how can RCB support our clients in case they have COVID, because they can alterate. It's just an example.
They can't what?
Get excited.
So what we've been doing when individuals have COVID, it depends on where they live, but we have been increasing numbers of hours of support when there's someone who's able to provide that support. The other thing that we've been doing is we've been providing the PPE, and we've been bringing that out to families. I think that it is really a balance. I think one of the things that is being done is that we're looking at what supports might be through alternative services. If someone can't leave the house because more than one family member is ill, and they need supports with other things like groceries, that is something we've been flexible that respite agencies could help with during this period of time. So we're looking at all of those kind of things. I'd be interested in what types of support Mary was interested in getting. Thanks for the comment on the different ways of communicating. I have a comment on supports and brochures that people might see in other settings. Okay, good, thank you. I think for us, what we've experienced during this time of COVID are a lot of different needs from different people. In our licensed residential and supported living entities, we're often having to fund some additional staff support so that providers can only limit the number of people in a home, so they can have people work overtime in order to reduce the number of people they're in contact with. So thank you. We'll take a look at that. Anything else? Or if if you come upon ideas in your head as we were thinking about things, we'd be really happy to get your feedback. Please use Write to Us. And also, please join our webinar when we're going to look at exactly what we're proposing for next year, so we can get your feedback on that. I've already taken down the ideas from here, and we'll look at how we could do some more resource development in certain communities, and having more ways that people know what the services are that are available in all communities. And it is, I know our system is overwhelming, and sometimes it's really hard for us to share all of that information. And so we do want to be very transparent, and I think some of these things would really help both the case manager to make sure they share things with you, and make sure that families are hearing what are the options. And I see Mary put a comment here.
Mary just saying that this is the question that she posed earlier. That was her question.
As a parents,
Yeah.
we always ask ourselves about this pandemic,
Yeah.
but we are fine.
Yeah. I mean, the other thing that we had developed a couple of facilities in case people tested positive for COVID, and their family also did, or people were dislocated. What we found is that our numbers have been fairly low, and we've been able to manage these cases mostly by bringing supports in or supplementing what's already there, which is important. Yeah. So Pam made a suggestion: could regional centers use volunteers as ambassadors to other communities and settings like farmers markets, etc.? Thank you. That's certainly something when we're looking at some of our numbers and doing outreach to bring people into the regional center system. So thank you. Okay. Well, I don't see many more questions, but again, thank you for joining us. And just wanted to share one thing is regional centers used to have many case management agencies that contracted to provide case management services, and most of those ended in the early 1990s. But one of them, La Familia Counseling Services, remains for a number of our monolingual Spanish-speaking families. And I just wanted to share Eda Buñuelos, who is here on doing translation. I did want to share that the agency celebrated 45 years of providing services in the community, and that's a major achievement of 45 years, and it's been 45 years of really transforming, aside from serving people with developmental disabilities and providing case management. La Familia has reached out in so many ways around housing issues, youth issues, criminal justice issues, and so I just want to give a shout out to them for that longevity and really commitment in this area. So we're glad to be partners with them. Thanks.
Thank you, Lisa.
Bye.